An ounce of prevention is worth a pound of cure. This axiom is often used in regards to one's health, but what does it mean? Our take on it is as follows. Many life-threatening diseases are preventable by following a healthy enough diet and lifestyle. This includes things like smoking, air pollution, activity level, sodium intake, whole plant food and trans fat intake, and many more. The risk for many chronic diseases is heavily affected by your diet and lifestyle choices. The same diet and lifestyle are unlikely to cure or at least help manage such diseases once you've got your diagnosis. Better follow a healthy enough diet and lifestyle now than suffer the consequences later on. Many chronic diseases like coronary artery disease, type 2 diabetes and chronic kidney disease take years to decades to become symptomatic. So for many, it is not even about prevention, but about curing the underlying progressing diseases they might already have. Remember to subscribe to our channel. Heart disease prevention. Coronary artery disease, causing excruciating chest pain and leading to heart attacks and death, is a preventable disease. Risk factors include the intake of trans and saturated fat and excessive processed carbohydrates, abdominal obesity, smoking, alcohol consumption, chronic stress and other chronic diseases like chronic kidney disease, type 2 diabetes and hypertension. On dietary patterns and lifestyles that are not healthy enough, with genes playing only a minor role, atherosclerotic plaque slowly builds up in coronary arteries and elsewhere. A healthy enough diet might consist of about 70 to 80% whole plant foods, is low in trans fats and salt, and leads to a healthy weight. Coupled with no smoking, rare alcohol consumption, and decent physical activity, the build-up of plaque might be prevented. Most people are far from following this kind of diet and lifestyle, which results in millions of preventable deaths worldwide every single year. On the other hand, a low-fat, whole-food plant-based diet, combined with certain lifestyle modifications as proposed by Dr. Caldwell Esselstyn Jr. and Dr. Dean Ornish, slows down and even reverses plaque buildup, the only diet proven to do so. Obviously, it is much easier, healthier and safer to follow a healthy enough diet and lifestyle than to follow the strict Esselstyn and Ornish style diet and lifestyle once you are diagnosed with coronary artery disease. You might not even have the chance to try this approach, as the first heart attack, which is the first symptom for many, can be deadly. Chronic kidney disease is similar to coronary artery disease, as it affects nearly everyone following an unhealthy Western dietary pattern and lifestyle at some point in their life. Most occurrences of chronic kidney disease are preventable, because it too is a diet and lifestyle driven disease. The progression of chronic kidney disease is measured by the decline in glomerular filtration rate, GFR. The risk factors for coronary artery disease are also valid for chronic kidney disease, as vascular health plays an important role in kidney function. Kidney-specific risk factors include high intake of animal protein and other acid-forming foods, high salt to potassium ratio, and the intake or formation of toxins like advanced glycation end products. Type 2 diabetes and hypertension play major roles in kidney health. They even lead to vicious cycles, worsening all three conditions. A healthy enough diet will preserve enough kidney function for you to never run into preventable kidney problems in your life. Unfortunately, most people are far from following a kidney-healthy diet and lifestyle, which results in declining kidney function with age, leading to dialysis or, more likely, an early death. Unlike coronary artery disease, which can improve by following a strict low-fat whole-food plant-based diet and healthy lifestyle, kidney function is unlikely to improve significantly once it has declined to insufficient levels. For chronic kidney disease, prevention is key because a cure does not exist. Type 2 diabetes is another preventable and luckily often reversible disease. The underlying mechanisms of type 2 diabetes are insulin resistance and inadequate insulin production by the pancreas, failing to control blood sugar levels, the symptom of type 2 diabetes. This condition also often worsens over years and decades, which can be measured by slowly increasing fasting blood sugar and hemoglobin A1C levels. The main risk factors for insulin resistance include abdominal obesity and the intake of trans and saturated fats, branched-chain amino acids primarily from animal protein, excess heme iron and fructose, and the intake or internal formation of advanced glycation end products and other toxins. In summary, a hypercaloric diet high in animal products and processed foods. Type 2 diabetes is different from coronary artery disease or chronic kidney disease, as it can often be reversed within a few months. Indeed, insulin resistance is reversible, and even insulin production can often improve again. This means that the ability to process healthy carbohydrate-rich foods can be regained. To prevent type 2 diabetes means to avoid the main risk factors of insulin resistance. Minimize unhealthy fats from animal products and tropical vegetable oils. Reduce branched-chain amino acids and heme iron from animal products. Avoid isolated fructose from sweets and sugar-sweetened beverages. Reach an ideal weight. Great gut health also plays an important role. Reversing insulin resistance follows the same idea, but special attention is necessary to keep blood glucose in normal ranges during the process. We will link useful resources on this topic in the description box. Let's summarize. Coronary artery disease, chronic kidney disease, and type 2 diabetes are mostly preventable diseases that worsen over years and decades before becoming life-threatening. Most people will suffer from coronary artery disease and chronic kidney disease in their lifetime, but may have yet to suffer from any symptom. A healthy enough diet to prevent atherosclerotic plaque buildup might consist of about 70 to 80% whole plant foods, is low in trans fats and leads to a healthy weight, coupled with no smoking, rare alcohol consumption, and decent physical activity. A low-fat, whole food plant-based diet and certain lifestyle modifications have been shown to slow down and even reverse plaque buildup. Obviously, it is easier, healthier, and safer to prevent plaque buildup in the first place. A heart-healthy diet is also a kidney-healthy diet. Kidney-specific risk factors for chronic kidney disease include high intake of animal protein and other acid-forming foods, high salt to potassium ratio, and the intake or formation of toxins like advanced glycation end products. The prevention of chronic kidney disease is key because a cure does not exist. To prevent type 2 diabetes, you need to prevent insulin resistance. Risk factors include trans and saturated fat intake, branched-chain amino acid intake from animal protein, intake of excess heme iron and fructose, abdominal obesity, and the intake of advanced glycation end products and other toxins. Type 2 diabetes is reversible in most cases. The ability to process healthy carbohydrate-rich foods can be regained. For more information, check the description box. Thanks for watching. See you next week.